Okay, the nurse understand that the diagnosis of oral cancer is confirmed with letter A, biopsy, B, gram stain, C, scrape cytology, D, oral washing for cytology. What's the answer? So the question here is, how do you diagnose oral cancer? It is confirmed by what? Biopsy, gram stain, scrape cytology, oral washing for cytology. The answer here is the best diagnostic tool for cancer is the biopsy. The assessment includes checking the lymph nodes. As answer B, C, and D will not confirm a diagnosis of oral cancer. Next question. The nurse is caring for the patient's post-surgical removal of a large posterior oral lesion. The priority nursing measure would be to A. Maintain a patent airway. B. Perform meticulous oral care every 2 hours. C. Ensure that the incisional area is kept as dry as possible. D. Assess the client frequently for pain using the visual analog scale. So what's the main question here? So it's the patient's post-surgical removal of a large posterior oral lesion. So what would be your priority as a nurse? So maintain a patent airway, perform meticulous oral care every 2 hours, ensure that the incisional area is kept as dry as possible, or assess the client frequently for pain using the visual analog scale. So we should know that we prioritize what? Maintain a patent airway. Maintaining a patent airway is paramount in the post-operative period. This is the priority of nursing care. So performing meticulous oral care every 2 hours, ensuring that the incisional care area is kept as dry as possible, and assess the client frequently for pain using the visual analog scale. These are applicable but are not the priority. The nurse should instruct the client to perform mouth care using a soft sponge, tooth it, or irrigate the mouth with normal saline. The incision should be kept as dry as possible and pain should be treated. Pain medication should be administered PRN. Next question. The registered nurse is conducting an in-service for colleagues about peptic ulcers. The nurse would be correct in identifying which of the following as a causative factor. A. Neisseria gonorrhea. B. Haemophilus influenza. C. H. pylori. D. E. coli. So what's going to be the answer here? The main question here is, you are conducting an in-service for colleagues about peptic ulcers. So you would be correct in identifying which of the following as a causative factor for peptic ulcer. It is what? H. pylori bacteria. This has been linked to peptic ulcers. If you answer H. influenza, H. pylori, or E. coli, these are not typically cultured within the stomach, duodenum, or esophagus, and are not related to the development of peptic ulcer. Next question. When the nurse is gathering information for the assessment, the patient states, "My stomach hurts about 2 hours after I eat." Based upon this information, the nurse knows the patient likely has a what? A. Gastric ulcer. B. Duodenal ulcer. C. Peptic ulcer. D. Curling ulcers. So, my stomach hurts about 2 hours after I eat. So, based on this information, what would you think it is? Is it gastric, duodenal, peptic, or curling ulcer? So, the answer here is duodenal ulcer. Why? Individuals with ulcers within the duodenum typically complain of pain occurring 2 to 3 hours after a meal, as well as at night. That pain is usually relieved by eating. The pain associated with gastric ulcers, answer which is the first one, occurs 30 minutes after eating. And peptic ulcer is too vague and does not distinguish the type of ulcer. And curling ulcer is associated with what? Stress. Next question. The nurse is caring for a patient with suspected diverticulitis. The nurse would be most prudent in questioning which of the following diagnostic tests ordered. A. Abdominal ultrasound. B. Barium enema. C. Complete blood count. D. Computed tomography CT scan. So it says here, what would be the most prudent in questioning which of the following diagnostic tests ordered? If you are caring for a patient with what? Suspected diverticulitis. Abdominal ultrasound, barium enema, complete blood count, or computed tomography CT scan. So the answer here is barium enema. It is contraindicated in the client with diverticulitis because it can cause bowel perforation. So you have to be prudent, okay? So abdominal ultrasound, complete blood count, computed tomography scan. These are appropriate diagnostic studies for the client with suspected diverticulitis. Next question. The nurse is planning care for the patient with celiac disease. In teaching about the diet, the nurse should instruct the patient to avoid which of the following for breakfast? Answer. Puff wheat, banana, puff rice, or cornflakes. So what's the main question here? So you have a patient with celiac disease. So what are you going to teach? And what are you going to instruct the patient to avoid which of the following for breakfast? Puff wheat, banana, puff rice, or cornflakes? So the answer here is the patient with celiac disease needs to avoid puff wheat. Why? Because client with celiac disease should refrain from eating foods containing what? Gluten. And puff wheat is full of gluten. Foods with gluten include wheat, barley, oats, and rye. The other foods are allowed such as banana, puff rice, or cornflakes because they don't have any what? They don't have gluten. The nurse is teaching about irritable bowel syndrome. Which of the following would be most important? Reinforcing the need for balanced diet. B. Encouraging the client to drink 16 ounces of fluid with each meal. C. Telling the client to eat a diet low in fiber. D. Instructing the client to limit his intake of fruits and vegetable. What's the answer here? So the main question first is, you are teaching about IBS or irritable bowel syndrome. So which is the most important here when you teach a client? So the answer here is reinforcing the need for a balanced diet. Okay, so the nurse should reinforce the need for diet balance in all nutrients and fiber. Foods that often cause diarrhea and bloating associated with irritable bowel syndrome include fried foods, caffeinated beverage, alcohol, and spicy foods. Therefore, answers like encouraging the client to drink 16 ounces of fluid with each meal, or telling the client to eat a diet low in fiber, or instructing the client to limit high intake of fruits and vegetables, these are all incorrect if you have a patient who have IBS. Balanced diet, okay, should be reinforced. In planning care for a patient with ulcerative colitis, the nurse identifies the nurse diagnosed as the priority. So what is the answer? Here are the selection: anxiety, impaired skin integrity, fluid volume deficit, or nutrition altered less than body requirement. So in planning care for a patient with ulcerative colitis, so what is the priority for nursing diagnosis for ulcerative colitis? The answer here is what? Fluid volume deficit can lead to metabolic acidosis and electrolyte loss. The other nursing diagnosis in answers like anxiety, impaired skin integrity, or nutrition altered less than body requirement might be applicable but are of lesser priority.